Go.
Okay, this is scene 1, bug repellent in the eye. First thing you want to do is remove the spray can. Check if the scene is safe, no further danger from the victim. Victim is still responsive but in pain. Next steps is to go down to the body and check their head and see if they're breathing properly. Checking the airway. Normal breathing, no signs of severe breathing. And then with your next step, you grab your water bowl and or sink and continuously help pick up the head and flush their eyes for a minimum of 15 minutes. If the victim's eyes are still irritable, check for medical help to your nearest hospital or call 911. All right, this is scenario 2, ankle injury. First thing you want to do is check that the scene is safe. Make sure that whatever the victim fell on is no longer en route to hurting them again. Victim is awake, responsive, breathing fine. No signs of them having life-threatening injuries. Their airway is clear, breathing normal, no severe breathing. Injury is still ongoing to the left ankle. First thing you want to do is make sure your victim sits up. Avoid putting weight on the left ankle that they sprained. And then you want to begin your RICE method. Your RICE method begins resting, ice, compression, and elevates. And that's exactly what we're going to do. So right here, you would allow the victim to sit up and rest their leg onto something. Like if they're on a couch or something, just make sure that they're resting and not on it, putting more weight on it. Next thing you're going to want to do is grab an ice packet and wrap it with a cloth and put it on their left ankle for roughly 20 minutes on, 20 minutes off, 20 minutes on, however the victim feels comfortable. And then next, you're going to do compression. You'd get bandaging. This is what we're using as a form of bandaging. And you'd wrap the left ankle to prevent it from any more swelling. And next thing you want to do is elevate it. And that's our RICE method. And after that, if there's any ongoing pain or injuries, seek medical attention. All right, this is scenario number 3. We have our victim at the food court choking. First thing you want to do is check if the scene is safe, no other spills or hazards. After that, you can clearly see the victim cannot speak, cough, or breathe. Those are classic signs of choking. Next thing you do is check if the victim's airway is blocked. The victim should still be conscious but unable to breathe. No other injuries that you can see of. First thing you want to do after that is to call 911. Someone around, just tell them to call 911. And then next thing you want to do is slowly pick up the victim, standing behind the victim. Wrap your arms around their waist. With one hand, you want to make a fist. Place it above the belly button area. And then with the other one, you want to hold your hand like this. And begin to start quick upward abdominal thrust until the object is expelled or they're unresponsive. So what you would do right here is you go like this and quick and assertive thrust to expel the choking hazard. And if they're unresponsive, slowly put them back on the ground and start to begin CPR. And that is scenario 3.